everyone. Today we're going to focus on the neck. I know pain in the neck is the horrible thing. Neck pain is very disabling and debilitating when you have a long work to do, especially working in the desk in front of a computer or laptop. As you know, there is a whole bunch of muscles in the neck, in the front, in the side, in the back. To strengthen those things, there are simple things you can do to strengthen those neck muscles. We're going to see some progressions too, starting with isometric work. Then we're going to use some resistant band. Then we're going to do a specialized equipment called the Iron Neck that joined our exercise equipment list now. It's a beautiful equipment there to strengthen the neck muscles, especially for the sports and athletic population, and also for the general population, whoever wants to have a very strong neck. A lot of NFL players and NHL players and athletes use that to have a very strong neck. So the progression from the isometrics we did with the self-resistance is using a band. So she's pulling the band and try to pull the head backwards against the resistance of the band, and a little bit of movement is there too. Okay. So this is the next level you can use other than the resistance too. And you can come to the side now, you can go to the side. Yeah. And then you can go that way and pull the band this way. Now you're working that too, a little bit more than the self-resistance. You can relax now. So this is another thing you can use here. You can use either the band, even if you don't have a band, you can also use a towel if you want to. This particular exercise is for the deep neck flexor muscles, which is really in the deep area of your neck. We can call it even the core muscles of the neck. A lot of people think core is only in the abdomen area. No, core is all along the spine. So this exercise can be done very effectively in lying position. Lying on your back like this, nice and relaxed one, good breathing. Then what you have to do is tuck your chin down and you maybe put one finger over there, Kyla. And keep maintaining that chin tuck, okay? Then lift your head just off the bed. That's it, not too much, just off the bed or the floor, and hold it there for a good 10 seconds with good breathing. We call it a chin tuck lift. That's exactly, you're actually lifting the weight of the head against the gravity. So that's the resistance you have. It's a great exercise. Start with a 10-second hold and maybe go up to 20, 30, 40, even go up to 60 seconds if you can. And if you have any pain, stop and consult your healthcare practitioner regarding this one. And that's your deep neck flexor firing exercise. So now we're going to talk about some soft tissue mobilization of your neck, especially the suboccipital muscles, the muscles just below your scalp and on the top of the neck, how to gently release that. You have to do this very gently, don't go overboard on it, and don't take your foam roller or a Theragun into that area. Nice a little tennis ball or lacrosse ball, just she put it underneath that suboccipital muscles under the scalp, and you can see that there, and gently work on it. Move your head just back and forth, nice and gentle, very small movement, and then up and down, very small area. Then keep changing the position to the middle to the other side as well. So this is your soft tissue release using a ball in that area, nice and gentle. So this equipment, it's called Iron Neck. This is mainly for strengthening the neck muscles in different directions with different resistance and with different movement patterns. Kyla's here to demonstrate some of from the simple ones to the hard ones, okay? Kyla, let's start. She's working on extension now. She's pulling that way and then working against the resistance. I can increase this resistance here also. And also I can increase the resistance by changing that strap also. The strap what she's using is about 10-pound resistance. We have strap with 5 pounds and 20 pounds also, depends on what she's doing. Now she's doing some rotation movements there. Yeah, and come across a little bit more. The more you go away from it, obviously you're going to get more resistance, and she's working on the rotational pattern now. For the neck muscle she's working, I can feel that neck muscles working everywhere here against this resistance. You do that and do some side flexion now, Kyla. Yeah, this way and that way too. Yeah, there you go. Side flexion. Wonderful. Okay, now showing different forms, doing on a lunge or the squat forms. So we can also modify the leg work. You can go to a lunge position and work on the neck, and also you can use your upper limb too. Yeah. And then you can do in squat positions. Yeah, squat positions, incorporate that, free hands, or also you can use the medicine ball in the hand. She's right now on the ground. You can do this exercise on the Therafoam or on the Bosu ball. We can increase the complexity so much in so many different ways, and we love this equipment. Our patients love this, especially after motor vehicle accidents. You're in the later stage of rehabilitation to strengthen your neck muscles after the whiplash injury. It's a great tool. Sports injuries, athletic injuries, rugby, hockey, anything you need. And soccer, and if you don't have a strong neck, this is a great tool and great exercise to use. Yeah, I don't mind having an iron neck. So the process begins now. I'm going to do some iron neck training for my cricket and also for my golf.